Good afternoon, everybody, and welcome to this parallel session of health, mental health, and nutrition. My name is Mark Hayward. I'm a health activist and a social justice activist, and I'm currently editing something called Maverick Citizen, which is a part of but more importantly, this afternoon we have two very important speakers. Dean Jimmy Volmink from the Faculty of Medicine and Health Sciences at the University of Stellenbosch, who's going to make the opening comments. Welcome, Professor Dr. Volmink. It's nice to see you. Nice to have you with us. And then to respond to his comments, the equally distinguished MEC for Health in the Western Cape, Noma French Mbombo. MEC, thank you very much for taking time out this afternoon to participate in this important discussion that seeks to link health to social justice at this conference. All I want to say by way of introduction is that the first social justice conference held by the University of Stellenbosch was a year ago in a very different world. It was before we'd even heard of COVID-19. And the second conference takes place in a world where COVID-19 has changed the health landscape in certain crucial respects, but in certain crucial respects, nothing has changed. I think it's changed because it has taken its toll on life in our country. As I'm sure you will explain, speakers, it's taking its toll on mental health, and it is taking its toll on our ability, on our health system, and on our health workforce. But what hasn't changed is that the other challenges of the health system have not gone away. In the context of COVID-19, HIV is still here. Tuberculosis is still here. Non-communicable diseases are still here. And in many ways, we face greater challenges because all of those other health challenges now have to compete with COVID-19. So I think that is going to be the basis for our discussion this afternoon. I'm going to start by asking the Dean to speak and set out the issues as he sees them, followed by the MEC, and then we will open up for discussion, which may just be amongst ourselves and with our rapporteur, Catherine. But hopefully by the end of this discussion, we will also pull out some key points that we want to take forward to a plenary session after this parallel session, and which we want to form part of the overall resolutions of this second social justice conference. So, Dean Volmink, over to you. You have 10 minutes or so to set the scene for us. Thank you very much.
Thank you, Mark, and good afternoon, colleagues. Mark, thank you for your kind remarks. I was not given a specific topic. I was asked to be a resource person in the session on health, mental health, and nutrition. But it just to get my thoughts together, I sort of gave it a topic of my own, which is something like how does COVID-19 harm our health, and what can we do to limit the damage? And I'm aware that I'm speaking to an audience that probably know more about this than I do. So this is really just an input to summarize the situation, and we can then perhaps have a free-flowing discussion after Minister Mbombo has responded to what I have to say. So I think let's just start by agreeing that COVID-19 poses an existential threat to people everywhere. The health and social consequences of the pandemic are far-reaching and quite severe. So I'd like to just touch on perhaps the different ways one can think of the disease inflicting damage on our health and well-being. First, I guess there are the direct effects of the virus on morbidity and mortality. We know that the total number of cases of COVID worldwide now approaches about 50 million, with over 1.2 million deaths being attributable to the disease. And in South Africa, more than 700,000 cases have been confirmed and around 20,000 people have died so far. Of course, these figures are likely to be underestimates of the true toll of the disease. And I think it's also important to keep in mind that even for those who survive the condition, the health consequences of COVID are often severe and prolonged. The term long COVID has sort of been coined to describe that. A second way in which I think COVID harms our health is through its impact on the health system. As we all know, in many countries, hospitals have been overwhelmed by the sheer volume of patients presenting for treatment, leading to facilities not being able to cope or keep up with the demand for personnel, equipment, and therapeutics. Now, while this has thankfully been less of a problem in South Africa, what we have seen is the negative impact of the pandemic on the provision of routine healthcare. For example, people suffering from diseases such as HIV, TB, heart attacks, stroke, cancers have had their care either delayed or denied. And children requiring vaccination for preventable diseases like measles have in many instances not been able to receive it. So these factors undoubtedly have contributed further to suffering and death. The third thing I wanted to mention was that COVID harms us, excuse me, by affecting our mental health. I think there isn't a single person who is not worried about the risk of infection to themselves and to their family members. And for those who have actually lost loved ones to COVID, they experience the pain and the fear so much more intensely. Add to that, I think one can think of students who are struggling to cope with online learning without the necessary infrastructure, workers who are struggling with working from home, and those that are burdened by the loss of income. All of those are major stresses. I think it's important also to specifically mention the frontline workers who continue to put their lives on the line for us during this pandemic. I'm talking here about doctors, nurses, and other healthcare workers, but also other essential workers who have been out there when some of us have been in lockdown. So the mental exhaustion, the stress, the anxiety that they have experienced continue to be quite profound. And yet this is not all. Isolation, psychological pain, stress, and anxiety, difficult as these human experiences are in their own right, also have further knock-on effects. So it's not surprising then that we are seeing an increase in alcohol abuse, domestic violence, homicides, and suicides. And then the fourth and the last area that I will mention for the purposes of this input is that our health can suffer as a consequence of the policy interventions aimed at controlling the pandemic. Public health measures such as social distancing and lockdowns are of course important, but we need to be cognizant of their serious unintended consequences. Lockdowns in particular have contributed to massive unemployment, hunger, and also social isolation. The HSRC recently, for example, reported that in the early phase of the hard lockdown in April this year, 28% of people were going to bed hungry. By July, this figure had grown to 40%, and between August and September, further increased to 43%. We know that even before the pandemic, South Africa was already one of the most unequal countries in the world, and that hunger was pervasive in this country. COVID has taken these problems several notches up. So let me then work my way towards the end by asking the question, so what can we say about the way forward? The first thing is that COVID-19 and its aftermath will, without a doubt, impact our lives for years to come. Our future today is more uncertain than it has been in a long while. Of course, we all hope to weather the current storm and reach a point where thriving will again be possible. But of course, hope is one thing, but it's not a strategy. If we are to rise above the current challenges, we will all need to be active role players in building resilience and finding long-term solutions. As we face the present and future, I think there are four things that are particularly critical. And I'll mention them right now, and then I'll just make a brief comment on each. The first is self-care. Second is compassion. Third is social cohesion. And lastly, sound policy. In terms of self-care, we need to make every effort to take good care of ourselves. The safety instructions on planes remind us we need to put on our own oxygen masks before attempting to put it on the mask of the person sitting next to us. We are in this for the long haul, and we must do all we can to preserve and bolster our mental and physical stamina. But we must also be willing to reach out for support when we need it. So that's self-care. Compassion. The coronavirus has left no one untouched. But what we do know is that not everyone is affected equally. Those who suffer most are the vulnerable members of our society, such as women, those living in poverty, older people, and people with disabilities and pre-existing conditions. If there was ever a time for us as South Africans to reach out to each other with kindness and compassion, that time is now. This is the time for generosity of spirit. So let's remind ourselves that compassion is not just about how we feel about the plight of others. It is about what we do to help relieve suffering. Thirdly, let me come to social cohesion. We are living in a time that calls for the recognition of our common humanity, for a real demonstration of Ubuntu. It is a time for us to hold hands and pull together. It is a time for renewed commitment to social cohesion, or the willingness to cooperate for the common good. And yet, as I say this, I know that social cohesion is not easy to achieve in the face of so much inequality around us. When people experience economic injustice and feel vulnerable, they do become dispirited and angry, and they do lose hope and become destructive. But I think that the pandemic should be seen as offering us a new opportunity to be brave and to join hands with those that have been forgotten and neglected. In a word, to reset. Lastly, I wanted just to touch on the need for sound policy. Going forward, we will need to develop sound policy with equity in mind. Public health measures such as self-isolation, quarantine, social distancing, and lockdowns will probably continue to be necessary, as will the tracking of infections and deaths. However, in tandem with this, we will need to respond to the social consequences of the disease, as well as the measures employed to fight it. Policy decisions will need to be, where possible, individualized to particular areas or circumstances, rather than resorting to one-size-fits-all approaches. Policies will need to be science-based, but we need to ensure that a sufficient range of disciplines are represented in the room where decisions are taken, so that we are not misled by narrow and simplistic narratives about what is best for ensuring our nation's health. Needless to say, mental health services must be accessible and timely. Food distribution needs to be stepped up and be kept free of corruption and fraud. Social safety nets must be strengthened, and jobs will need to be created. So in closing, perhaps just a quote from the 2020 Nelson Mandela Annual Lecture, which was delivered, as you know, by the United Nations Secretary General Antonio Guterres. The pandemic, said the Secretary General, quote, has laid bare risks we have ignored for decades. Inadequate health systems, gaps in social protection, structural inequalities, environmental degradation, the climate crisis. And then he added, quote, COVID-19 is a human tragedy, but it has also created a generational opportunity, an opportunity to build back a more equal and sustainable world. As we move forward, the financial constraints under which government will operate will be very real. And I'm sure Minister Mbombo will reflect on that. But we cannot afford to be locked into a scarcity mindset. So it is my hope that we will take hold of this once-in-a-century opportunity to ensure that whatever we do, we do what it takes to survive, but not only to survive, but also to thrive as a nation. Thank you.
Thank you, Prof. Volmink, for very important, wise and considered and compassionate words that I think have very well set the context and ended up particularly by making the connection to social justice and social cohesion. I'm going to move straight on to MEC Mbombo and to your opening comments, and then we can have a discussion amongst ourselves. I should also just, I didn't properly introduce Professor Catherine Chu at the beginning of our session, but she's a medical doctor in her own right. She's our rapporteur this afternoon. But thank you, Catherine, for the role that you are going to play as well in keeping the record of this this discussion. Thank you, Catherine. But over to you, MEC Mbombo.
Okay. Thank you. Just to check, it's 15:34. So this session will be until 4. So we need to have time for discussion.
If you could speak for about 10 minutes, MEC, that would be great. Okay. And then that would leave us 15 minutes or so.
Okay. Thank you. Just to take it off from where Prof ended, in the context of what has been happening in South Africa in regard, even before COVID, the issue of the three challenges, the unemployment, the poverty, and the inequality, which actually find that it's health that absorbs these challenges more than any other sectors, because we do know that when a person is unhealthy, that person will not be able to go to go to work, and also it will impact on the profit as well, and also vice versa. When the environment there it's not conducive, it does have an impact on health general. So we started at the foot where we started. It's where actually even those three challenges that were never addressed. So by the time that we had the lockdown level 5, which had quite a huge impact on the economy, which again have had to absorb all of those. So that's why for us, we never created binaries when it comes to the economy versus health, because those two go hand in hand together. Also, the COVID came at a time that even the approaches in health for us in South Africa, some of the social determinants of health, they were never addressed because we still had those working in silos in regard to, for example, the sanitation, the sewerage, and other parts, gender inequalities, which is form part of the social determinants of health, because we have always been more biomedical in regard to managing this, yet you'll find that all of these do have an input. Also pre-COVID, the public-private, we have never worked in regard to where we find that the patient can be able to be anywhere, especially in regard to the public when our services are full, yet next door we find that we could be able to explore that part of it. So we have never been up to at that level. When it comes to the healthcare workers, the whole package is specifically psychological package, especially in contexts where the environment where they not only being attacked by the patients themselves when the patients have to queue very long, but even the environment related to the employer-employee, and also in the labor space. It was never been there. So I'm just highlighting some of these examples that actually were there even during pre-COVID. Now, with the 6 months that we have had COVID, one has to make it a point that to take all of these into context, up to the level now where the non-COVID services that have to be paused in order to prioritize the COVID. So you can understand that the situation was quite dire in regard to that space. Talking about mental health and also the nutrition, the lifetime prevalence in adults, for example, when it comes to the issue of the mental health, we find that in the Western Cape is the highest compared even to the other provinces, even prior COVID. And if you look in terms of the nutrition, also in terms of the mental health space, if you compare the differences, I think it was an NIDS study, when you compare the 2018 and also the 2020, when they look in terms of the study, look in terms of the mental health of adults, and also granulating it according to the gender, you'll find there quite a large difference in terms of the post or during the COVID, because we're not even post-COVID, in terms of the mental health status. The malnutrition, specifically among the children, the vulnerable. Now we're talking about children who used to access nutritious meals through schools, the ECDs, where also they used to also provide such. And then you get an environment where we find that now there is not even such an access when it comes to the food for the children. The older persons, in terms of using their grants, even pre-COVID, for the whole family, now with the young ones, the youth specifically, who use it is to go out during the day looking for work. They don't have to rely much on the older persons in terms of their food provision. Now, because of the lockdown, they ended up being there at home. take into consideration that even the messages that we're sharing, the NPI, non-pharmaceutical interventions, wear masks, we're saying these to the people where social distance, where you can't even physical distance within your own household. So how much more the social distancing? So in the essential service worker space or businesses, you'll find that they could be able to physically distance in terms of going to the shops. But what is the use when they go back home? They cannot even physically distance, let alone in terms of the mask wearing. So I'm trying to paint the picture that was there even the pre-COVID. Where are we now? In May, when we took the dive in the Western Cape, because whilst we could be able to say that we managed to manage the pandemic better, however, the issue of the non-COVID cases or health services, where the 60% decrease in the utilization of the mental health services, where the HIV, especially in terms of the screening and also initiation of the first treatment, the ARVs, the TB, the immunization, specifically the measles, the first dose, the antenatal care services. That's when we said that these kind of services actually they are low risk, and yet in terms of the high impact and also the consequences if we don't prioritize those. Therefore, we have to now, in terms of changing the queue. It is true what Prof has indicated, that currently the face of the COVID is poverty, it's inequality, which has actually gone worse. The issue now, policy-wise, what is it that we are doing? We have to do, how we respond to it as a government. Health system cannot do it alone. So that's why the issue of the humanitarian approach interventions, working transversal, that's one of the lessons we got from the COVID. What we have been actually for health, we have been actually trying to bring in terms of working across all departments, because it's not only whilst we are responsible for the health services, but health is everyone's business. So the issue that we ended up using the hotspot strategy of the COVID to identify those families, those households that were at risk, in order at least to bring dignity in those households. So it's one of those. That opportunity, when we were working with a private to access beds for critical care, now it makes us easier going towards the universal health care coverage to continue working in that space, because again, the system of South Africa is still, because of this inequality, so it provides us that opportunity also for such. Also the opportunity where we could be able now to use frameworks such as using the SDGs, applying across specifically on nutrition and also on the mental health. As you can see, the SDGs from 1 into 17, they speak across along in terms of what needs to happen. Just making an example with the SDG 5 that talks about gender equality. How do we ensure we provide a good nutrition and support, and also support to women, and also even the issues related to the child support? So it provided that opportunity, because the mere fact, it was other lessons, the mere fact that we could be able to build a 662-bed hospital within a month, it means that gone are the days when the government takes so long and give all the kind of excuses when it comes to implementing stuff because of all of these compliance measures. But with the departments, especially the HODs, coming together to come up with these kind of solutions, it made us to make that provision. So in conclusion, because the Prof spoke about the policy imperative, we have the provincial recovery plan that looks on 3 areas, but the central important one is about how do we bring dignity. What do you mean by the dignity? It means that dignity needs to be protected throughout your life. It's about opportunities for work and the income needed to live, because you might get as many cost pakkies, but an ordinary person would rather want to have access jobs, whilst the course package will assist during the time that is trying to access job and also to feed the family, because it does impact on the dignity. So there's this dignity, and then we have the issue related to the jobs, issue and access to economic opportunities, the well-being, which is the whole package, not only physical, but also mental and social. It talks to the issue that Prof mentioned about the social cohesion, and also about the safety, which it actually does impact across. And that has to be done, implemented, which we have already busy doing across the life cycle in terms of the lifespan, starting from the unborn child, the first 1,000 days, first 2 years of a child's life, and regard to the safety plus also into the nutrition, are those ones that are very crucial going there. So in closing, in terms of the social justice, what we have, the lessons learned, it's about the status quo of the unemployment inequality and the poverty that was there before the COVID. It's going to be worse. And the interventions, especially from our case as health, is no longer biomedical, because we might be having all of these, the specialists and the high-level impact evidence-based in relation to the managing the disease and all of those. But until we close the tap, we're still going to keep on mopping the floor. Closing the tap, it means that you have to go and work with the people. So the system that lacked was a people's system, which now we have to go back and have an engagement and bring more of the people in the spaces through the health committees, the hospital boards, and all others. As you can see, I'm wearing this T-shirt that says Vulimpilo Recover Health. So we are recovering those services, but we have to recover those with the people, because one thing for sure, we'll never be able to go back and have some of the, like the issue of the elective surgeries that were delayed, but at least we could be able to do something around that. So indeed, Prof, I agree. The issue of the compassion, the issue of the social cohesion, the issue of even the basic services, because no one would have ever thought that we could be able, because I think we got an opportunity where everyone could listen to us. And now that people could listen to us, we could be able to say, hey, when local government, make it a point that you improve sanitation there, because we normally get high level of diarrheal disease in that area and so forth. So we're using that opportunity. The same applies with the private. They rely on us, private health, during this time. And then it makes it easier going towards the universal health coverage, public-private partnership, and also to take care of our healthcare workers, because without them, we wouldn't have been able to where we are. And for lastly, to work closely with the unions, with the labor, which now they form part of our decision-making, not only the provincial level, but in each and every facility in regard to the occupational health and also in safety measures for the staff. Let me stop there. I'm looking like 15:48. Yes. Thank you.
Thank you very much, MEC. I'll be cheeky and say, I wish you'd come and run Gauteng, where I'm based, because there are real challenges, but also because I think what you've said again is very wise and on point in terms of the next phase of our response to COVID. So we have 12 minutes to talk amongst ourselves, 11 minutes to talk amongst ourselves. Catherine, please feel free as well to make any comments. I think what we really need to do between the four of us is decide what are the kind of key points that we want to carry into this next discussion that get reflected in this social justice charter. I've noted down things that both Prof. Volmink and yourself have said, MEC, and Catherine will have done that as well. I think the critical headline points that need to be made. I would just ask you both one question. I've heard the points about social determinants, but you know, I was deeply involved in Life Esidimeni, and it strikes me that mental health care services have not improved substantially, if at all, since Life Esidimeni. And yet now we've got this massive new burden of mental stress and mental illness as a result of COVID-19. Would you suggest a particular plan might be necessary just to recognize and target mental health and to help people through and beyond this period? That's just my question, but of course feel free to speak on any issue that you want. Prof, MEC, Catherine, if you want, just speak when you want to speak.
Probably I can start, and then the Prof maybe can follow that. Some of the changes, drastic changes that we had to do during the COVID at the time that the epidemic was highest was about destabilizing most of the hegemony kind of way how we did things, specifically around the mental health. For example, for the 72-hour observation, for those who are not necessarily being diagnosed, the way they used to go to the district hospitals, we have to divert them and then they go to the specialist hospitals so that you can relieve the district hospitals to focus on the COVID so that you don't mix the patients. So the mere fact, and in those specialist hospitals, we added more spaces, like in the Falkenberg and all of those, so that we can be able to accommodate such. But one particular intervention, it's about making use of the telephone access. So people, when they go, also the messaging that people can understand that is sadness, depression is more than sadness. When you feel like you have depressed, there is a number to call. That our specialists were available through in terms of the telephones. And also for some of them who actually couldn't be able to, those who normally get admitted, I'm talking for the mental health users, where actually they could have an access at the community health center level for those. So that's part of this. So for me, it is crucial for the more access in regard to telephonically, as we do with the physical health, or also telemedicine, and also for just as we do with the learners during the exams, even for suicidal tendencies, we should be able, because again, in terms of the stats that I saw, you'll find that there have been more those who are at the higher education, I mean, with a high level of education, who are the middle class, that we saw actually there's been an increase in the mental health issue. Understandably, some of them might be business people and they couldn't cope and they had nowhere to go to. I think we need to have more access instead of the institutionalizing people. So it's one of those that I'm recommending.
No, I would agree with those comments. You know, I was a GP in a previous life in Mitchell's Plain for about 12 years. And I saw my patients came from Mitchell's Plain and Khayelitsha by and large. And, you know, the most frustrating thing was to see the lack of access to mental health support. So this is not a new problem. This is an issue that has been in existence for a very long time. In fact, one stage we were having conversations that we say, you know, rich people see psychologists and poor people go to church to get their mental health support. And, you know, so I do think that there are structures in the community, such as faith-based organizations, other voluntary groups, that could be supported to play a more effective role. Because, you know, if you're untrained, you know, you sometimes do the wrong thing. So I don't think we're going to be able to scale up fast enough numbers of psychologists and psychiatrists in this country. We're going to have to look at different levels of healthcare work, mental health workers, but also to use the resources that are in the community. and support those, because I think a lot can be done by just having somebody that you can talk to, somebody that can help you work through something. So the mental health support often is, helping people get through a difficult situation. So helping to build resilience. And then others would be where people break down and, have pathology that needs to be managed. And all of that's necessary. But ultimately, Mark, I think, at the end of the day, I really just feel that, as with every other condition, it's not good enough just to simply treat the condition. It's important to look at what's behind it, what's causing it. And the minister spoke, earlier about the social determinants of disease. There are social determinants of poor mental health. And unless you're dealing with that, you will never be able to cope with dealing with all the mental health issues in communities.
Thank you very much, Prof. And I'm going to take that point made by both yourself and the MEC into this final resolution. One of the critical things that you have both stressed is the need to address the social determinants of health and the social determinants of COVID-19 in the next phase of our response, because I think that connects very squarely to this question of social justice, but also to what the MEC was talking about the way economy and health are woven into each other as mutual determinants. Catherine, do you want to, because I now see that we have 4 minutes or 5 minutes left, do you want to suggest what you think are the key points, having listened to both MEC and Prof, that we ought to take forward? And then if you can do that, then I will just allow Prof and MEC a minute each just to say, yeah, that's good, but I think add this or add that. And then we'll wrap things up. Catherine, is that okay with you?
Absolutely. I hope you can still hear me. My internet seemed to be coming and going. Possibly it. Apologies. Can you still hear me?
I was about to say we had you loud and clear and then we lost you, but try again.
I know. Okay. So it seems like, to summarize, with the MEC kind of discussed that in pre-COVID conditions, we had sort of three major issues. We have still three major issues: unemployment, poverty, and inequality. And on top of that, she highlighted that in the Western Cape, mental health issues really are high, in fact, higher than other provinces. And she also mentioned that social determinants of health were really not addressed before the pandemic. And then Dean Fulmig started out by saying that, first of all, the COVID pandemic has been an existential threat to everyone. And he mentioned 4 different areas: obviously morbidity and mortality, the number of people that have been affected and have died; the stress on the health system, specifically the collateral damage to other health services such as HIV, say surgical care, but he forgot to say that. The third thing was mental health. And then the fourth thing was just health effects of some of the policy interventions that have been made around controlling the pandemic, such as the massive unemployment and social isolation. And then he led into 4 things that we can kind of do. He mentioned self-care and compassion, social cohesion, and then sort of sound policy and making sure that there isn't a one-size-fits-all plan, and for sure getting multi-sectorial input into policies. I think that was one mistake that we made. We were very biomedical, and that leads into the MEC's comments. And I think the main thing is that the solutions are people-oriented and not biomedical. She mentioned transversal, multi-sectoral solutions. She mentioned looking at the whole picture from an SDG framework, so looking back at poverty, at gender equality, that have come out of the COVID situation. And the first was there was been a big public-private sector divide in healthcare, but with COVID, we were able to access private beds for public patients around COVID, and I think specifically ICU beds. So that was sort of one win. And then also the fact that the Western Cape managed to build 2 COVID hospitals in rapid time, I think represented a coming together of a lot of the different sectors, also very positive. But I think moving forward to address Prof. Volmink's questions around policy and what sound policies can we use to move forward, she mentioned ensuring kind of dignity throughout the lifespan, jobs, improving well-being, mental and social, and then back to just wrapping up again about the social justice is really about addressing the unemployment, poverty, and inequality, which the COVID pandemic has just exacerbated. Thanks.
Perfect. Thank you very much. You'll send those notes to me. MEC, Prof, is there anything you want to just throw in 30 seconds that you just think needs particularly strong emphasis, or an idea that may have just come to you? We've got maybe a minute left if you want to do that. Yeah,
funny that Catherine should be thinking of surgical services, but sorry, Catherine, that I neglected to mention that. Mark, I think the only other thing that we have seen in this pandemic is the role of corruption creeping into this. And I think it's worth a mention. The social determinants of health are so important, but previously we have not. We've not had a lot of people who, in fact, people frown at you when you talk about health and you talk about social determinants of health, because I think so much of health in terms of hospitals and clinics and so on, COVID creates a window of opportunity to really, really open this discussion about the social determinant, because people can now see it for themselves. And I had one visit to Cuba, and I was really, really impressed by what they have been able to achieve with really very rudimentary medical services, because they've taken care of the social determinants of health. So that's all I really want to say at this stage.
Thank you. Thank you very much. MEC, anything?
I'm covered, and thanks, Prof, for adding the part of the corruption. Because at the end, it's taxpayers' money. Thank you.
Okay, well, thank you. Prof, thank you, MEC, thank you, Catherine. Even though it's only been the 4 of us, I've found this worthwhile, because it's been at least an opportunity for me to see both of you and have a conversation with both of you and get to know you in a little way. I will call on you in future, undoubtedly, in my activism and work in the Daily Maverick. Thank you to Catherine. Catherine and I have worked a little bit together before, but really thanks for the preparation and the thought that you put into this, and let's keep working together, because there's a long way to go before we're out of the woods, but you know that.
Well, thank you for doing an excellent job of chairing, and also for the work that you do and the writing that you do. I think it's very inspiring to see what you are doing.
Yes, and for keeping us in toes.
Okay, I'll keep doing it, but thank you for all that you do. Okay, thank you both.
You.
And thank you, Catherine.
Thank you.